Hi, we're going over chapter 5 today in the Modern Dental Assisting book. This chapter is about dentistry and the law. So it starts out talking about statutory law. So statutory laws can be categorized into two types, criminal law and civil law. Criminal law involves crimes against society, and civil law involves crimes against an individual with another individual initiating legal action, like a lawsuit. So there are different types of each of these laws. In criminal law, we have felony, which is a criminal offense of a major crime. It could be like insurance fraud or drug abuse in the dental setting, and the conviction can result in imprisonment for 1 year or longer. A misdemeanor is a lesser offense than a felony, and that can result in a variety of penalties like fines, loss or suspension of the license to practice dentistry, mandatory continuing education, counseling, or community service. So an example of a misdemeanor is a dentist who violates a regulation of the Dental Practice Act in your state, like if they failed to follow infection control guidelines. Or even a dental assistant who performs a procedure that's not legal in the state they're practicing in. So if you're practicing outside of your scope, doing things that are not outlined for your duties in the Dental Practice Act of your state, then you are committing a crime. An infraction is a minor offense that usually results in a fine. So let's say maybe the dentist didn't pay their renewal fee for their license. They may be charged with an infraction and have to pay a fine for that. Civil law involves crimes against an individual with legal suits over wrongdoing against an individual or company resulting in damages or loss. When we are dealing with civil law, we're looking to compensate the victim. With the Board of Dentistry, a administrative board is commonly referred to as the Board of Dentistry, is who interprets and implements state regulations. So some states, for the dental board, they're appointed by the governor of the state. The board's going to adopt rules and regulations that are going to define, interpret, and implement the intent of the Dental Practice Act. So they're going to tell you exactly what duties you are and are not allowed to do, and it will outline that very clearly in your State Dental Practice Act. This board regulates and enforces the laws of practice for dentistry within the state. So the ADA and the American Dental Association believes states should have the power to decide who is qualified to practice dentistry and who is not. So that's why it is left up to each state to make these rules. Licensure is in place to protect us, the public, from unqualified or incompetent practitioners. So you must have a license to perform certain duties. It could be the license to practice dentistry so that you can do all things dental, or it could be a license to be a registered dental hygienist, there that you are allowed to do certain preventative functions like cleaning the teeth, placing filling, or not fillings, but sealants, and polishing the teeth. So it doesn't matter what state you're in, there are requirements for practicing dentistry, and if you are practicing without a license, you're guilty of an illegal act. So requirements from licensure vary from state to state, and there is something that's called reciprocity. And reciprocity is an agreement between two or more states that allows a dentist or a dental hygienist who is licensed in one state to receive, usually without further examination or requirements, a license to practice in any of the other states in the reciprocity agreement. So not all states have reciprocity. So you can only use that benefit when you are going to another state that has reciprocity from a state that has reciprocity. So licensure by credential. Having a license to practice in a specific state is one method of supervising individuals who practice in that state. So we need to have a currently licensed individual in one state to become licensed in another state without further education or requirement if certain requirements are met. And the requirements vary by state. So this is not only for dental hygienists and doctors, this is also for dental assistants. They do have reciprocity in some states for certain dental licenses for assistants. In your State Dental Practice Act, it outlines how it's going to protect the public from incompetent practitioners. It also is going to specify the legal requirements for the practice of dentistry in each state, so what you must do to be able to do each function. There's also an administrative board, usually called the Board of Dentistry, that interprets and implements the state regulations. So you can get a copy of your State Dental Practice Act at www.ada.org or go to your state dental website. So in a typical Dental Practice Act, it has the following things so that are listed here. The requirements for licensure, requirements for license renewal are at the top, and very important, you have to be licensed in order to provide dental treatment to anyone. There are reasons that those licenses can be revoked or suspended. And there are requirements for continuing education. That means that any license that you hold, you will have to take additional continuing education credit units to keep that license valid when it's time to renew it. Depending on the license or credential will depend on how many continuing education credits you need. Like when you guys graduate and you get your dental radiographer certificate for your state, when you go to renew it every 2 years, you're going to have to upload a copy of a CEU or continuing education unit. Those can be done live and in person. They can be done at different types of conventions and trade shows, and they can also be completed at home. So you could go on to dentalcare.com or colgate.com and create a professional account. And with that account, it will give you access to free continuing education. You will, each one that you pass, you will then get a certificate, and you'll keep that certificate, but it will also stay loaded into your account so that when you go to renew your license, you have it ready to renew. With expanded functions and supervision, expanded functions are specific intraoral functions delegated to qualified dental personnel with additional skill and training. So you must have this additional skill and training to be able to do the expanded functions. These functions will be included in your State Dental Practice Act, and the dentist may delegate them to the dental auxiliary that is qualified to carry out that function. Another name for dental auxiliary is a dental assistant or a dental hygienist, someone else that's working in the office with the doctor to help them complete their daily duties in the clinic area. California, it says here, is the state that permits expanded functions for qualified dental auxiliaries. I know that Ohio is another state that allows expanded functions for qualified dental auxiliaries. So you can become a qualified dental auxiliary by taking your RDA, which is your registered dental assistant, or your CDA, which is your certified dental assistant. And then you would need to build on to that certification or go back to school and you could become an EFTA, which is an expanded function dental assistant. So here we have the doctrine of respondent superior. What that means is that the employer is responsible for any harm caused by the actions of an employee while they're carrying out the business of the employer. So it means that ultimately the doctor is responsible for everything that happens in the office. That doesn't mean that they're the only person that can be held responsible, though. So the dentist can be sued by a patient for an error committed by the dental assistant, dental hygienist, or the dentist. But the patient can sue the dental hygienist or the assistant as well. So the employee is responsible for their own actions, and the injured patient may also file suit against, like I said, the dental assistant. So you have to be careful. Like, let's say you were being careless and you were taking an x-ray and accidentally smacked the patient in the head with the x-ray unit. Yes, it may have been an accident, but it's also negligent in your behavior. So because of that, they could file a lawsuit. With a patient of record is someone who's been examined and diagnosed by a licensed dentist and has had his or her treatment planned by that dentist. So it's not someone that is there for just an emergency, but someone who is there for continued treatment. When we talk about the different types of supervision, the first one they bring up is direct supervision, and that means the dentist has delegated a specific procedure to be performed for a patient of record on a legally qualified dental auxiliary. So with direct supervision, the dentist must examine the patient before delegating the procedure and again when the procedure is complete. The dentist must be physically present in the office and or the operatory at the time of the procedure is performed. So that is direct. So think direct supervision. They're directly in contact with the dental assistant and the patient that day. Then we have other types of supervision. There's an indirect supervision, and with indirect supervision, it's when the dentist can delegate a specific procedure to be performed by a dental auxiliary for a patient of record, as long as they meet this minimum requirement of the State Board of Dentistry. The dentist has to examine the patient before delegating the procedure and again when the procedure is complete. But the dentist is not required to be in the operatory, but remains in the office at the time or task the procedure is performed. So they may not be in a room with you, but they will be in the building with you. And then there's general supervision. And the dentist is not required to be in the office when a procedure is provided under general supervision. So you might think, when is a patient going to come to the dentist when the dentist isn't there, right? Well, that could be maybe for an emergency appointment. The patient may have a temporary crown and the crown came off and needs to be temporarily re-cemented. That is something that you could do under general supervision. In Ohio, there's also things that can be done like with a hygienist. As long as they meet certain requirements, they can do cleanings on patients without the doctor in the office. Some of the requirements that must be met besides licensure are that the patient has seen the doctor within a certain predetermined amount of time as outlined in the State Dental Practice Act. And then the doctor has to review the records when they come back, any x-rays that were taken or notes that were taken on that patient during their cleaning. With the unlicensed practice of dentistry, an assistant or a hygienist might legally perform only things that are delegated under the State Dental Practice Act in the state that you work in. Now remember, it's the state that you work in. So let's say you live on the border of two states, and maybe you live in Ohio, but you work in Michigan. You cannot do anything that's outlined in the Ohio State Dental Practice Act when you're working in Michigan. You have to do what is outlined in the Michigan State Dental Practice Act. The duties are very different from state to state of what assistants can and cannot do between Ohio and Michigan. So you have to know what it is that you are doing and why you're doing it and that you are allowed to do it. If you perform a procedure that's not legal, it's practicing a license or practicing dentistry without a license, and that's a criminal act. So that can be a felony or a misdemeanor. Just because you don't know what the Dental Practice Act says, that's no excuse for illegally practicing dentistry. So you can't say, I didn't know that I wasn't allowed to permanently cement a crown, because we know that we're not allowed to do that, but just because you don't specifically know that doesn't mean that it excuses you. If that is your profession and you are working as a dental assistant, it is your responsibility to know what you are and what you are not allowed to do. If the dentist asks you to perform an expanded function that's not legal in your state and you do that, you're committing a criminal act. It does not matter that the dentist has asked you to do it. What matters is that you did it and it was illegal. So if a dentist does ask you to do something that you know that you're not allowed to do, as a duty of a dental assistant, you need to be able to talk to your doctor, not in front of the patient, but in a room outside of the patient operatory, and let the dentist know that that is not a duty that you are allowed to do as outlined in the State Dental Practice Act, and that you are not comfortable in committing a crime. With the standard of care, it's a level of care at which the average provider with similar training and experience would practice in the same area or a similar locality. If a dentist fails to meet the standard of care and the patient's injured, the dentist might be held liable for malpractice. Competent and experienced dentists are often called to witness and testify in court in these cases. So due care, it says generally has a duty of due care. Due care is the legal term that means effort made to avoid harm to another with proper and sufficient care in the absence of negligence. So the dentist has that legal obligation to provide due care when they're treating their patients. When a drug is administered or prescribed, due care implies that the dentist is familiar with the drug and its properties. The dentist must also have adequate information regarding the patient's health to know whether the drug is suitable for the patient or whether the patient's health record contraindicates its use. Therefore, a complete, up-to-date health history is essential at every single appointment. Even if they were just there last week, we still need to update the health history. Abandonment refers to the discontinuation of care after treatment has begun, but before it's been completed. So if a patient comes into your office and they have work that needs to be done, and they start that work, it's the dentist's obligation to see that patient through the rest of that treatment unless they choose to go somewhere else. The dentist cannot abandon them in the middle of treatment, say because they missed too many appointments or their attitudes don't work well together, things like that. So even if a patient refuses to follow the instructions and fails to keep those appointments, it says, you cannot legally refuse to give the patient another appointment. So if you have already started seeing this patient, you must see them through to the end of the treatment plan, unless they decide to go somewhere else. You cannot dismiss or refuse to treat a patient of record without giving the patient written notice of termination. So if you do dismiss a patient from your practice, you have to do that in writing and give the patient 30 days to find a new dentist. So for the next 30 days, you would still see that patient on an emergency basis. If you do not give that 30-day notice in writing, it can be considered abandonment, and that is a criminal act. Patients also have responsibilities and legal duties to the dentist. They're legally required to pay a reasonable and agreed upon fee for services, and they're also expected to cooperate and follow the instructions regarding treatment and home care. Sometimes dental professionals forget that patients have a responsibility for their oral health, and we need to gently remind them of this fact, that it's not all going to fall on the practitioner, that if they're not also taking care of their mouth and their oral health, that whatever restorations that are completed will fail. Malpractice is professional negligence. Failure to provide due care or the lack of care. Dental malpractice occurs when a dentist fails to provide reliable, safe, and effective treatment in accordance with his or her standard of care. So there has to be 4 conditions met for a successful malpractice lawsuit, and they're called the 4 Ds. The first is duty. That's the dentist-patient relationship must exist to establish the duty. So they must have be a patient of record. Dereliction. Negligence occurred because of the standard of care was not met. Say maybe they were doing a filling and they didn't put the bonding agent in. So that would be the negligent act, is not putting the bonding agent in and curing it first for a composite filling, because the standard of care is not met, because that's not what anyone else in that profession would do for that procedure. Direct cause. The negligent act was the direct cause of the injury. So if their filling fell out or their tooth broke because the bonding agent was not used, then that tooth breaking or the filling coming out is the direct cause of the negligent act. The last thing is damages. They can include damages and compensation for pain and suffering, loss of income and medical bills, and among other things. So remember that malpractice is professional negligence, or the failure to use due care or the lack of due care. Then they go into acts of omission and commission. There are 2 types of malpractice in dentistry. They're acts of omission or commission. So omission would be if you omit a step. Like here, the example is if a dentist fails to diagnose periodontal disease because they do not take x-rays or perform periodontal screening. So x-rays are, as a standard, taken 1 time a year, and the periodontal screening should be done every 18 to 24 months or less, depending on your provider. So if a patient had periodontal disease and it didn't get diagnosed because the doctor wasn't taking x-rays or doing the periodontal probing for the periodontal screenings, that is an act of omission because they failed to do something they needed to do to make the treatment successful. An act of commission is just the opposite. That is when they do something they commit an act of commission. The dentist administers 15 cartridges of local anesthetic to a very small child, resulting in serious overdose and death of the child. So they committed the act by what they did of administering the 15 cartridges of local anesthetic to a small child. So remember, omission is not doing something, commission is doing something, but they're both illegal acts. The doctrine of res ispa loquitur, meaning the thing speaks for itself. So in this, say the dentist extracted the wrong tooth, and the proof would be that it was the wrong tooth that was extracted. So say they were supposed to extract number 1 and they extracted number 16 because the x-ray was flipped. That is, the dental assistant and the dentist need to make sure that those x-rays are mounted and mounted correctly. So the dentist is looking properly at the mouth. And the dentist also needs to examine those x-rays and make sure the anatomy is correct so they're looking at the right side of the mouth. Now we're going to go down to risk management. In this age of increasingly action in lawsuits, as a dental team member, you have to be constantly aware of the need to avoid malpractice risks in the dental practice. And that's what risk management is prevention of lawsuits. The best way to prevent a lawsuit is to have good communication with your patients, a good dialogue and back and forth communication to make sure they understand what the expectations are of them and of the provider for each appointment. Making accurate and complete records. You don't leave anything to memory. You always want to complete your records as soon as you are, while you're seeing the patient, or as soon as you're finished with that patient. It is important that we mark down everything that we do. If it's not in the chart, it wasn't done. So anything that happens, even conversations, we need to not diagnose, but we need to document those in the chart. Receiving informed consent. So making sure that the patients are aware of what the treatment is that they need, what the cost is going to be, and what their alternatives are. Doing everything possible to maintain the highest standards in clinical excellence should be something that you strive for every day, and that will also help to prevent lawsuits. The best way to avoid legal problems is maintaining a good rapport with open communication with your patients. So make sure that you are listening to your patients and that you are informing your patients on procedures before they're completed and after they're completed. The going home instructions are very important. Patients are less likely to initiate a lawsuit if they have a clear understanding of the treatment that has been planned for them, results that can reasonably be expected, potential obligation or complications, and financial obligations. All of those are informed consent, those 4 things. So we need to make sure that our patient is giving a full informed consent and that they do understand all of these aspects of the treatment. In the next slide, it says silence is golden. So what that means is you should never make a derogatory remark about dental treatment rendered by your employer or any other dentist. If you don't have anything nice to say, don't say anything at all, basically. So statements made spontaneously by anyone, including the assistant, at the time of an alleged negligent act are admissible as evidence and can be damaging to the dentist and dental assistant in a court of law. So you want to refrain from saying things like uh-oh or oops. Those things unnecessarily frighten patients. They make them feel that you've made a mistake or the doctor's made a mistake and that something is wrong. So silence is golden. We need to be quiet unless we're being productive and positive. With informed patient consent, the implied consent is given when the patient agrees to treatment, or at least they don't object. So it's less reliable form of consent in a court of law should there be a malpractice suit. So with implied consent, you walk into the office for your cleaning, the hygienist brings you back and does your cleaning, x-rays, the doctor comes in and does your exam. It's implied that you're given that consent by walking into the office for that appointment. With written consent, it's the preferred means of obtaining and documenting the patient's consent and understanding the procedure. So written is when the patient would sign the actual document that you have reviewed with them so that we all know that we have their consent and that they do understand that procedure in full. So in a legal situation, we would want to have written consent versus the implied consent, if possible. To assist the patient in making an informed decision about whether to undergo the treatment that's been recommended, or the dentist should explain the nature of the proposed treatment. So what kind of treatment is it? What needs to be done? And what does this procedure involve? The benefits of the proposed treatment and the consequences of not undergoing the proposed treatment. So how is this going to help them have a healthier oral health? How is this going to improve their oral health overall? And what will happen if this treatment isn't completed? What kind of consequences might they face? The most common and severe risks associated with the proposed treatment should be outlined to the patient so that they understand what they're looking at as far as any kind of risk or complication. We should also go over reasonable alternatives to the proposed treatment, including risks and benefits of each. So although there is a treatment plan from the doctor and what the doctor recommends, there may be other courses of treatment to do the same thing. So say a patient is missing a tooth. We could do a bridge, a partial, or an implant to replace that missing tooth. The doctor is going to choose the optimal treatment plan for that patient and go over informed consent with them for that procedure, but they will also let them know what other procedures could be done in place for replacing that tooth. So when a patient gives informed consent, they have to have enough information about their condition and the available treatment to make an informed decision. We also have informed refusal. That's when a patient refuses the proposed treatment. The dentist has to inform the patient about what kind of consequences they're going to face and obtain the patient's informed refusal. So let's say a patient comes in and they don't want to have x-rays and they haven't had x-rays in over a year, and we know that that is the standard. That is what the doctor is going to recommend, that they have the 2 bite wings or the 4 bite wings taken in the posterior region. The patient has the right to refuse that treatment, but they have to know the consequences of refusing the treatment, and we need to have an informed refusal signed. It doesn't release the dentist from the responsibility of providing the standard of care. So even though the patient says they know that they need x-rays, but they refuse them and they sign for it, it doesn't release the dentist from the responsibility of providing the standard of care. So we cannot give them substandard care just because they request it or because they cannot afford the treatment plan that was presented to them. A patient may not consent to substandard care, nor can the dentist ethically or legally agree to provide it. So patients could actually be dismissed from an office if they refuse x-rays too many times. That is up to the dentist, of course, but the dentist can give them a letter of dismissal because they're not allowing them to provide the standard of care by taking the x-rays. So we don't know exactly what is going on. Because if the patient came in and said, okay, well, now I have a toothache back here on number 30, my lower right first molar, and they needed to have that rectified, there's nothing that we could do without an x-ray. So we would have to have that to provide the standard of care. With informed consent for minors, minors are children under the age of 18, and their parent or custodial parent or legal guardian has to give consent before they can be treated in the office. Here it says when parents live separately, the child's personal information should indicate which is the custodial parent. When separated parents share custody, the child's records should contain letters from each providing consent and authorization to treat. So legal custody is the relationship with a child provided by court order giving a person legal responsibility for the physical possession of a minor and the duty to protect, care for, and discipline the child. When you're documenting informed consent, most states do not require specific means for documenting discussions on informed consent. But at a minimum, the patient's record should indicate that the patient received information about the risks, benefits, and treatment alternatives and consented to or refused the proposed treatment plan. When treatment is extensive, invasive, or risky, a written informed consent document is recommended. The patient, the dentist, and a witness should sign this consent form, and the patient should receive a copy of the form while the original is kept in their chart. So we recommend informed consent, especially in these following types of situations. If a new drug is to be used on the patient, if experimentation or clinical testing is involved, if a patient's identifiable photograph is going to be used, if a minor child is treated in a public program, and that's meaning like a lot of elementary schools will have like a sealant program or a hygiene program where they go and clean the children's teeth or put sealants on their teeth at no charge to the parent or a very minimal charge. With those programs, the provider has to have gotten informed consent from the parent or guardian prior to treating that child. And we want to document informed consent if the treatment takes more than 1 year to complete. So if it's going to be a long treatment plan, you definitely want to get informed consent. So on your informed consent forms, they should have the nature of the proposed treatment, benefits and treatment alternatives, risks and potential consequences associated with not performing the treatment, and anything else that's necessary for that particular case. These forms do not absolutely protect the dentist against the patient who alleges he or she was not fully informed, but they greatly increase their chance of defense in allegations if they're signed by the patient and on record. Dentists usually refer a patient who has a dental case or a medical condition beyond their scope of expertise. The dentist must inform the patient that the needed treatment cannot be performed properly at their office and that the service of a specialist is required. And then the dentist should help assist the patient in finding the appropriate specialist. And typically the doctor will give them one or more referrals to a specialist with a name and phone number. And I know in the offices that we worked in, or that I worked in, I always would look at their insurance to see which providers were covered before I gave them a referral from the doctor. With failure to refer, a lot of malpractice claims involve the failure of a general dentist to refer the patient to a specialist when it needs attention. A lot of times you'll see that with periodontal disease, the failure to recognize periodontal disease and refer the patient to a periodontist is a very common cause for this type of lawsuit. So we need to make sure that we're following the standard of care, taking the x-rays and doing the periodontal screenings. When a patient is referred to a specialist, the referral should be thoroughly documented in the patient's chart. So in that referral, it should have a description of the problem, a reason for the referral, and the name and specialty of the referral dentist, and whether or not the patient has agreed to the referral. When it comes to guarantees, no one should be giving a guarantee in the office. Outcomes of dental care cannot be completely predicted. We don't know how the tooth or the bone or the tissue will ultimately respond, so we can't promise or guarantee any kind of treatment outcome. Because if you make a promise or a claim about the outcome of care, it could be interpreted as a guarantee. So, on the next slide, the contributory negligence occurs when a patient's action or lack of action negatively affects the treatment outcome. The patient's record should include notations of broken appointments or last-minute cancellations. These actions may be interpreted as contributory negligence on the part of the patient. So documentation of broken or canceled appointments helps protect the practice from legal recourse should a patient claim negligence against the dentist. Patient records are an important legal document. Each patient is going to have their own record and it has to be protected and handled with care. Included in that record should be all of the exam records, diagnosis, radiographs, consent forms, updated medical histories, copies of medical and laboratory prescriptions, and correspondence to or about a patient are filed together in the patient's record. That's also called the dental chart. The only part that is not in the patient record or the dental chart that's in a separate record is the patient ledger. That is the billing part of it for the account services. The dentist technically owns all patient radiographs and records. Now, patients do have the right to access, meaning to review and remove their records and radiographs. However, they should not be the originals. If a patient calls and says they would like a copy of their records, first you need to follow the procedure in the office, but you should never release those records or even copies of those records without the dentist's permission first. In many states, dental personnel are required by law to report known or suspected cases of child abuse. That's because we're in a good position to identify signs of abuse in our pediatric patients. So if you see signs of child abuse, like rips and tears in the lips, bruising in the face, marks around the neck, things like that, as a dental assistant, you are not a mandated reporter, but a hygienist and a doctor are mandated reporters. And ethically and morally, you should report that if you do notice child abuse. You should go to your doctor and discuss this first. A mandated reporter can't not be sued for reporting suspicions. So if the dentist or hygienist suspected the child abuse and called the authorities, they would not have repercussions for that because we are working with protecting someone and trying to make sure that this person is in a safe environment. Child abuse is legally defined as any act of omission, so not doing, or commission, doing something that endangers or impairs a child's physical or emotional health and development. So they could be physical abuse and corporal punishment that result in injuries. It could be emotional abuse and deprivation, physical neglect or inadequate supervision, or sexual abuse and exploitation. So if you suspect child abuse, make sure that you are talking to your doctor about this particular patient and your concerns. Because remember, even though children may be abused because they have bumps or bruises on them, children are children and they do get rough and they do things that they can hurt themselves that could also look like abuse. And you don't want to be calling the authorities on every patient that falls down or that got hit with a toy by a friend. For domestic violence, it's the term used to describe battering, abuse, or control over an intimate individual within the same household. It usually starts with controlling behavior on the part of the abusive spouse, and it becomes more frequent and more aggressive. We have to be sensitive and supportive for our patients that we believe are in domestic violence situations, and document any evidence that might suggest abuse. Because even though some states require that spousal abuse must be reported, adherence to this mandate can be difficult. And that's because the victims might deny the incident or say the report was filed without their permission. Oftentimes, people that are being victims of domestic violence, it does take them a while sometimes before they will admit to the abuse. With elder abuse, it occurs when a relative or a healthcare provider abuses an elderly patient. So the same with child and spousal abuse, we have to look for signs of physical abuse or behavior that suggests abuse, such as being withdrawn. Elder abuse can be physical, sexual, or emotional. It can consist of passive neglect, willful deprivation, and most commonly financial exploitation. One of the problems with identifying elderly abuse is that the elderly person may not wish to report the actions because it's a family member and they don't want to get that family member in trouble. With dental neglect, it's the willful failure of a person or a guardian to seek and obtain appropriate treatment for caries and oral infection. So when people fall under the guidelines of dental neglect, you can see untreated rampant caries easily detected by a layperson, which means someone that is not skilled in dentistry or not trained in dentistry would be able to look into the mouth of that patient and very easily see that there is decay and infection going on. If there's chronic pain, a delay in the child's growth or development, and the child's difficulty with or inability to perform daily activities such as playing or going to school. So dental neglect, because of not treating decay, it can get so bad that it can not only cause pain, but that delay or retardation in the child's growth or development could be from not eating. They could be malnourished because they are in so much pain that they're no longer getting the proper nutrition that they need. Or their inability to perform daily activities like playing or going to school. Maybe they're in so much pain from this toothache that they're not able to go to school. So they're missing school. They're missing playing with their friends. So they're missing out on social norms and social activities that they should be involved in because of the pain resulted from the neglect of the mouth. Immunity states, in many states, legally require the reporting of suspected child abuse. So what immunity is, it's you're immune from criminal or civil liability for reporting, and that's granted as required. This means that you cannot be sued for reporting your suspicions to protect a child. So us being healthcare providers, we should be protecting and wanting the best for all of our patients, but children, people, or the elderly, people who are defenseless, we need to be a voice for them. And the final thing is HIPAA. The purpose of HIPAA is to provide consumers with greater access to healthcare insurance, to protect the privacy of protected health information, promote greater standardization and to enhance efficiency in the healthcare industry, and dentists and all dental healthcare professionals must follow the HIPAA regulations. So HIPAA is the Health Insurance Portability and Accountability Act that allows us, or not allows us, but allows patients to feel more comfortable because they know that their information is being protected.